Hey everyone, welcome to my health sketch today. Today in our video session, you'll be focusing on one of the most important topic for nursing assistant or caregivers, which is providing care for infants. And it's important for nursing assistant or any healthcare providers who care for infants because infants needs gentle care and the right techniques because they are in the developing stage. So through this video, you'll be learning the right techniques and methods. So don't forget to watch the video till end to gain your knowledge. These basic skills not only ensures baby's comfort, but it builds your confidence and the right way to care for the infant. So stay tuned and watch till end. As we move into the session, let us focus on one of the most important responsibilities in nursing assistant care, providing safe and effective care for infants. Before handling a baby, always remember to maintain a proper hand hygiene, wearing clean gloves to prevent infection. The first position, the cradle hold. In this position, the baby rests gently in your arms with the head supported in your bend of your elbow. Your other arm supports the baby's body and bottom. Let's check out some of the benefits of the cradle hold. Number 1, provides warmth and security. Number 2, encourages bonding between the CNA and the baby. Number 3, keeps the infant comfortable, especially during feeding or when they are asleep. Now let's move to the shoulder hold. In this position, the baby's body rests upright against your chest and shoulder. One hand must be always support the baby's head and neck, while the other hand supports the back. The important reasons for the shoulder hold is helps the baby to burp after feeding, reduces the chance of choking, allows the baby to observe their surroundings while still feeding is secure. Next is the football hold, also called the clutch hold. In this technique, the baby is tucked along your forearm like folding a football with the head supported by your hand and the body resting along your arm. So now let's see the use of football hold. The very first thing is it's very useful for mothers who have had a cesarean section since it keeps the baby away from the abdomen, provides a good control for the infant's head, a very helpful position for the feeding twins at the same time. And remember, the baby's neck should always be straight, not bent, and your grip should be firm but gentle. The next position is upright hold. Here, the baby sits upright against your chest or your shoulder. One hand supports the head and neck, while the other hand supports the back and bottom. The benefits of upright hold helps the baby digest food better, reduces the chances of gas or reflux, keeps the airway clear and comfortable during breathing. As we move to the next part, lifting and transferring the baby. When lifting a baby from a bed or a flat surface, move slowly and carefully. Let's check out the safe steps for lifting. Place one hand under the baby's head and neck. Place your other hand under the baby's bottom and back. Lift the baby gently and bring them close to your chest. Here are some safe reminders that I can give you. Never shake a baby, never toss a baby in the air. Avoid sudden movements, especially after feeding, as this can cause discomfort or even harm. During this time, always try to maintain a proper and a professional body posture to maintain safe and comfort for the baby. Feeding techniques is a critical part in infant care. Correct feeding posture always maintains a professional technique method. The baby's head should always be slightly raised. The bottle should be tilted so milk flows steadily, prevent air entering inside. Never feed the baby while they are lying completely flat. Why posture matters? It prevents choking, helps the digestion, and makes feeding a calm and a safe experience. If the baby begins to choke, do not panic. Do not attempt to unsafe and random methods. Follow the proper infant choking protocols to clear the airway safely. Infant clothing during care. During feeding or general care, it is good to use a soft cloth or a bib to protect clothing from spills. When dressing or changing clothes, always handle the baby gently. Pay special attention to the joints, arms and legs. Sudden pulling can cause injury. And always remember, move slowly and support each limb carefully to prevent discomfort. After the clear explanation and demonstration practical, my students are given a chance and an opportunity to practice their hands-on experience. In our training, students also practice each holding techniques under supervision. This hands-on practice is very important because theory alone is not enough. Why practicing matters? Builds confidence, helps you to correct your mistakes earlier, ensures you fully prepared for real-life care situations. Remember, in nursing or caregiver, practice makes you confident and confidence makes you safe. Importance of body posture and infant care. Let us highlight one final important point: body posture. When walking with a baby, hold them close to your chest, support the head and back. Infant care is not just about holding, it is about protecting and nutrifying the baby during their most valuable stage of life. As healthcare providers, it is our responsibility to ensure they feel safe and comfortable during the care. With this session, we have practiced the essential techniques of infant care: cradle hold, shoulder hold, football hold, upright hold, and safe lifting and proper feeding techniques. These skills are foundation of good nursing practice. By applying them with the patience, gentleness, and professionalism, you will ensure the safety and healthy development of every infant care in your life. Thank you for watching my video, guys, and I hope this video has given you the right knowledge and demonstration skills on providing care for infants. And if you find this video useful, don't forget to subscribe my channel and press the bell icon, and stay connected for more real-time scenarios and practical trainings.